Okay, so now in this scenario, we're dealing with the adult victim who's in cardiac arrest with an AED. And before we get started, we need to talk about scene safety for a moment. Is the scene safe? We have our gloves on, we have our CPR shield, so we know the rescuer's safe, but are we safe to use an automated external defibrillator? They can give off a spark when it defibrillates, and if so, we don't want to have to worry about combustible gases or liquids, and we don't want the patient lying in a pool of fluids that might connect the rescuer to the patient when we defibrillate. So as long as the scene does not have that in the environment, we're good to go. Now let's get started with the scenario. So as soon as I call out to the patient, hey, are you all right? Can you hear me? They don't respond. I tap and shout, sir, can you hear me? They still don't respond. I'm going to activate EMS by calling 911. I can either do that with my cell phone by dialing 911 and keep it on speakerphone, or if I've got a bystander, I can tell them, hey, you in the plaid shirt, go call 911 and come back. And if you can find an AED, bring it with you. Now in this case, I already have my AED with me, so that's not as big a deal. Now let's go ahead and continue. So I know that the patient is unresponsive. I assess to see if they're moving, and I see that they're not breathing normally. If I didn't have the AED, I would go straight into CPR compressions until AED arrives. But because I have an AED available, the first thing I'm going to do is turn it on.
Remove clothing from person's chest.
I'm going to remove the clothing and dry off the skin where I need to put the pads.
Attach pads firmly to person's chest as shown.
I pull out the adult pads and I place the pads correctly. One above the right breast, one on the left mid-axillary, below the left breast. And now I plug in the pad connector.
Analyzing rhythm. Everyone stand clear.
Not touching the patient.
Shock advised. Charging. Everyone stand clear.
Check to make sure no one's touching the patient. Everybody's clear.
Everyone stand clear. Push the shock button. Shock delivered. Begin 5 cycles of CPR.
1 and 2 and 3 and 4 and 5 and 6 and 7 and 8, 9 and 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. I grab my rescue shield with a one-way valve, pinch the nose, tilt the head back, and give 2 breaths.
Minute and 30 seconds of CPR remaining.
2 breaths go in, go right back into my 30 compressions. 15, 16, 17, 18, 19, 20, 21.
Rhythm. Everyone stand clear.
Stop touching the patient while it analyzes.
No shock advised. Begin 5 cycles of CPR.
Whether it advises to shock or not, we're going to go right back into our CPR as prompted, and we're going to continue this until EMS arrives, until further help arrives that's equally trained or higher, or my patient begins to move and respond and breathe normally.